I'm Dave Kaiser from CCX Media. Thanks for joining us for this special update, and we are going to talk Hennepin County response to COVID-19. We are honored to be joined by Dan Rogan, who is the Assistant Hennepin County Administrator over Operations, and for people here in the Northwest Suburbs might recognize Dan as well as a Robbinsdale City Council member. Dan, thanks for joining us. How are you today?
Very good. Happy to be with you, Dave.
We appreciate the time to update some folks on COVID-19 in Hennepin County. Again, a lot of the responses and operations that you're doing. First, let's talk COVID-19 in general in Hennepin County. What are some of the points and information that you've been telling people about the county's response and what you're seeing in the county?
Sure. Well, I think one of the things, Dave, to keep in mind is how new this is, how recent it is. And it's really been something that's recent, obviously, for Hennepin County, but also for the country. And I think one of the ways to bring that home is if you think of 90 days ago, there were 0 cases in the United States. And if I look down at my numbers here, 60 days ago, there were 150 cases. 20 days ago, there were 56,000 cases. And today there's over 90,000 cases. So in just 90 days, you know, the country has gone from not really having to deal with this to having it be something that is front and center for everybody. And that is certainly true in Hennepin County as well. We have over 6,000 cases now in Hennepin County. And unfortunately, we've had a lot of hospitalizations and a lot of deaths in Hennepin County. And so it's something that is really at the forefront of what the Hennepin County Board and County Administration are focused on here in Hennepin County is looking at ways that we can really try to react to COVID-19 and try to make sure that we're protecting our residents the best that we can.
And we'll talk a little bit more about that preparedness and some of the response in a minute. One of the big issues and one of the focal points has been long-term care facilities, Dan. So tell us a little bit about those facilities within the county and what type of work you are doing and information you're gathering from them.
Sure. So, you know, one of the sad things about COVID-19 is it is really most impacting our seniors. And if some of the statistics again are, so Hennepin County is about 23% of the state's population. And we had, as I said, about 6,000 cases, and that's about a third of the cases in the state. So we have slightly more cases in Hennepin County than we do statewide. But when we see some of the hospitalization numbers, we have over 1,000 hospitalizations in Hennepin County related to COVID, which is 47% of the cases in the state. And of the deaths, we have over 500 deaths in Hennepin County now, and that's more than 63% of the deaths in the state. So even though we're only 23% of the population, our county represents 63% of the deaths in the state. And unfortunately, that is primarily in our long-term care facilities. This is really significantly impacting people who are 70 years and older, and those folks are more likely to, if they get COVID-19, end up in hospitals and unfortunately end up dying. And so it's something that we have been tracking and that we've been working with the State Department of Health on, really trying to work on ways to help prevent COVID spread in these facilities. And that's really working with the facilities, working with the state on making sure that people have the right personal protective equipment, that they have the right protocols in place, and that when there is COVID in some of these facilities, that they're doing everything that they can to prevent further spread within the facilities. And so it's a multifaceted response, and the county has a role in trying to help facilitate some of this, but it's a state function because all these facilities are licensed through the Minnesota Department of Health. But in light of the COVID-19 outbreak and what we've seen in Hennepin County, County Public Health has really stepped in to start doing more testing and consulting with some of these facilities to really try to help change the arc of what we've seen happening so far. We really are looking to try to turn those numbers around and get back to having our numbers be more reflective of what's happening statewide.
Any particular facilities here in the Northwest Suburbs that you've paid special attention to? I know there have been some, obviously, that have been profiled in the news.
Certainly, yes. You know, St. Therese is in New Hope is a place that's been on our radar screen, and we've had reach outs to St. Therese, and it's something that county staff have worked with. And St. Therese has, you know, facilities in New Hope and in Brooklyn Park, and We've done some testing out there already, and we're going to continue to work with that facility to try to make sure that we can make those residents as safe as possible.
We had talked with Commissioner Opad about a week ago to find out a little bit of the whole scope of Hennepin County's response. You give us a little inside look at that, if you could. Tell us about the operations standpoint. What has it meant for your staff? What has it meant for changing response during COVID-19 for the county?
Certainly. Well, it's been kind of remarkable to see how quickly the county has been able to respond. We have myself here working remotely. We have, over half of our staff are working remotely now. And we have many places that can't work remotely, our correctional facilities and some of the court functions, and some, other places people do have to be in our facilities and working from there. But remarkably, we've been able to move quickly to a remote environment and have been working remotely for almost the past 10 weeks with a huge number of our staff. And we've really been able to come up with some innovations to make that possible, to be able to do some remote marriage license applications, to doing many different things that we think of that that residents would go to a service center and get done. They can do over the phone and through a virtual meeting like we're having right now. And so that's something that we've really focused on to try to make sure that we're able to do our important work and to do the business that the residents are looking for, even in this remote environment. And so we've really leaned into our technology, and it's really been something that has dramatically changed over the past few months, like everybody else. But it's been remarkable as the leader of operations to see how many people are able to get their work done remotely. It's been really a good thing to show me how our staff can respond and quickly adapt to a changing environment and continue to provide those important public services.
In a nutshell, Dan, just how many employees does that touch? How many employees are you dealing with at the county? I don't think people understand sometimes the scope of the county's employment.
Sure. So the county has, over 8,500 employees. So it's one of the larger employers in the county overall. And so we have I would say more than 5,000 probably employees that had been showing up at physical locations. The county operates about 121 buildings across the county. And many of those buildings are closed to the public or closed to employees in general. And all those employees are working from home. And so we're the second largest government in the whole state. The state is obviously bigger, but we're the second largest. And we've really been able to move quickly to that virtual environment with all of those employees, with everybody with a laptop at home and doing all of their work at home. It's likely to change the way that we practice government in Minnesota and in Hennepin County in the future. We've really learned a lot over these past several months.
Let's take people to the next step then. How about the preparedness plan? What are you planning right now for the next step and the possible rollout of new opportunities opening up to the public once again, and also some changes in what has to happen if people come to the facilities? Give us that overview if you could.
Sure. So just this week, the county board passed a COVID-19 preparedness plan, and that really is modeled off of what the state has required for businesses to reopen. And the executive orders that have been passed by the governor really apply to non-critical functions and how they can come online. Obviously, Hennepin County has most of the work that we've done to date has been critical functions. And so we didn't have to follow the plan that is required for non-exempt or for non-critical workers, but it's something that we as a county really felt like it set out a good structure for how to make sure that we can keep employees safe and our residents safe. And so we passed a plan that really requires all of our departments to go through a new safety protocol to make sure that our facilities are set up so that we can do social distancing, and that we have cleaning procedures and the appropriate personal protective equipment that's going to be needed to perform these functions. And so that's all going to be implemented over the next several weeks here for our existing work that's happening at the county right now. And it's also going to be applied prospectively to any of our work that's going to start to come online over the next few weeks. And important for residents to know, one of the major parts of the plan dealt with face coverings. There's been a lot in the media about this, and this is one of those things that's changed over time. That in the beginning, the CDC and MDH, didn't really have any thoughts about it, or didn't really talk about everybody wearing a mask or a face covering. And now that's really suggested strongly by the CDC and MDH. And the county went ahead and passed a requirement that for both employees in our buildings and for visitors to our buildings, that they're going to need to wear a face covering. And so that's something residents should be aware of. We're encouraging people to bring their own face coverings, and if they don't have one, we will supply a paper mask for folks in our buildings. And that's really designed, as I'm sure many people know, those face coverings are really, they're not designed to necessarily protect the user of the face covering. It's really to protect everybody else. It's really a way to make sure that in case you're asymptomatic or somehow have COVID-19, that you don't infect others, or you have less of a chance of doing that. And so it was a significant step for the county to do that. The county board passed that after much discussion on it, and it was implemented just yesterday on Thursday. And our implementation has gone well so far. And we are hopeful that most people are gonna bring their face coverings, and unfortunately, it's going to be, I think, our new normal for a while is people wearing face coverings and face masks when they're out in public buildings and in restaurants and other places where they're going to be near other people.
Dan, final question, if you can talk about a few of the facilities that are key places for people to do county business in the northwest suburbs. So Brookdale, Ridgedale, and also some of the other libraries sprinkled throughout. What is the latest on those operations?
Yep, certainly. So the courts have started to reopen, and our courts have started to reopen at the Government Center downtown. And starting June 1st, they're going to open in Brookdale and in Ridgedale. And so both of those courts will open slowly to some in-person cases. And so residents, might be out there in some of those locations, and we will be using our policy and requiring masks for people coming to those facilities. Also, Dave, we're going to be, we've opened some of our libraries to curbside service, including both Ridgedale and Brooklyn Park are open right now to curbside service. And we are looking at continuing to expand that curbside service, and so there'll be other libraries that will be opening. And hopefully sometime later this year, we're going to have some facilities, including our libraries, be open to people coming into those facilities to do some of that. It's still so early, and we're still trying to work on all the logistics of this to try to make it so that both our employees and our residents can be safe when they're in our facilities. And so we're really trying to be thoughtful and planful about that. But we recognize that a lot of those services, especially our libraries, are really critical to our residents across the county. And so we're really focused on trying to figure out ways to bring those services virtually to our residents, but also recognizing that some of those buildings really are places that we need to try to find ways to get people back into them in a safe way.
And as you mentioned, things changing on a day-to-day basis here. So the website is a great place for people to go to get the latest. So hennepin.us/COVID-19, the place to go for information. And just in general information about some of those curbside opportunities, hennepin.us, again, website to go to. Dan, thank you so much for your time today, and thank you for the great work of you and your staff there at the county. And we look forward to possibly talking again to get people more updates on what's happening in the county.
Great. Thank you very much, Dave.
Thank you.
Learn more about The Connection at ccxmedia.org and follow us on social media.